techniques designed to encourage movement through the joints themselves, especially spinal manipulation. Every segment of the spine has small little joints known as facet joints, which help stabilise them and guide movement. There's facet joints in many different areas of the body, and what manipulation does is a short little thrust movement done with speed to encourage these joints to move. Very aware that most of us assume clicking and cracking on bones as a bad thing, but in terms of manipulation, it's not actually the bone that cracks. It's the release of pressure from within these joints themselves. Joints use fluid to glide themselves around, and you can get build-up of pressure within this fluid, and that can create what we call a bit of a pressure vacuum and can limit the movement. It's the exact same principle as a can of fizzy drink. If you shake that can up and increase the pressure within it, you'll get a big hiss or crack or pop when you open the can up, and that is a similar noise to what you're hearing when we do these manipulative techniques. They could be good for many things. They could be good for increasing proprioception, which is basically your body's awareness of where it is. There's some evidence to suggest that they also might be very good for help with hypermobility. There's another saying that suggests that you keep clicking something, it will lead to arthritis. It doesn't directly actually lead to arthritis. What it can do is increase the mobility of the joint. And if a joint gets hypermobile from you constantly pulling it and stretching it, eventually the muscles will start to tense up to try and give the joint some stability. Typically we get that stability from the ligaments. If the muscles are under constant tension to try and stabilise the area, you are probably going to get some adverse effects from that at some point. So that tends to be the theory around the clicking. But it's a very safe technique, could be a very effective technique, obviously if it's done correctly.